بسم الله الرحمن الرحيم والصلاة والسلام على خاتم الأنبياء محمد صلى الله عليه وسلم. Your Excellency Dr. Ahmed Al-Saidi, the Minister of Health, the Chairman of Board of Trustees of Oman Medical Specialty Board, Your Excellency Dr. Hilal Al-Sabti, the Executive President of Oman Medical Specialty Board, my colleagues. This is Dr. Badal Alawi welcoming you all and thanks for being with us today. In this interesting webinar, which will be about leadership and building public trust, collaboration for a resilient health system to combat COVID-19 by His Excellency Dr. Ahmed Al-Saidi. Before we start, just to give the attendees the general instructions, the attendees can participate only by asking questions through Q&A button found at the bottom of the screen. The questions you will be asked will be presented during discussion at the end of the talk. So now I will leave the mic to His Excellency Dr. Hilal Sabti to welcome His Excellency Dr. Ahmed Saidi and start the webinar. Dr. Hilal, the mic is yours.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. We would like to welcome His Excellency Dr. Ahmed Saidi on our first series of a webinar. It's OMSB Excellence in Healthcare. And we chose His Excellency يتوج هذا الevent because of the major role that he has been playing nationally and internationally. This is going to be a series where we'll be welcoming, and there's no better than having His Excellencies to crown the start of this. His Excellency is also the Chairman of the Board of Trustees. Right now we have more than 300 physicians, Your Excellency, with us on board from all over the world, starting from Australia, going all the way to North America, through Europe, and quite a good number of people also from locally, from all of them in having pandemics, whether it is for the human developments worldwide, and their impact in health are often severe and could attain a global restrictions. Existing pandemic of COVID-19 really is a classic example of what have been going on, and the complex health system is well delineated. Recently, I had read one of the quotes of His Excellency when he said that we need to sit back and look into our health systems. Yeah. So, معالي الدكتور, we would like to start the discussion, and I will start with, and it's going to be a discussion. We're going to start with the first questions, معالي الدكتور. The nature of the public sector management and leadership is changing, especially during this crisis of COVID-19 pandemic. And the pandemic is definitely a best example. What is the most common, if we talk about the whole government or a whole society, challenges during this pandemic, and how do you address them usually?
السلام عليكم ورحمة الله وبركاته. مساء الخير سعادة الأخلال وأبنائي وبناتي الأطباء والمنتسبين للقطاع الصحي أينما كنتم. أولا كلمة شكر وتقدير وإجلال لكم جميعا على ما تقومون به من أعمال جليلة في مكافحة هذا الوباء. أنتم كما ذكرت في عدة مناسبات أنتم خط الدفاع الأول. You are the soldiers actually in this battle, which started late last year, in late December, and it's unfortunately continuous. Before I forgot, please, wherever you are, our priority is your safety. Our priority, and as I always say, the most important precious thing in healthcare are our human resources. And I know, unfortunately, there's a sizable number of you were infected. Alhamdulillah, the recovery rate in healthcare professionals in Oman is great. We have, as you know, probably one of your colleagues, unfortunately, who is in ICU, and I'm following his case on daily basis, twice a day. this virus or this pandemic, unfortunately, caused major shock to world systems, whether it is healthcare, economy, or social. And the challenges which are faced by countries worldwide, they vary dependent on their healthcare structure and strength, the cultural value as well of each society. And in Oman, and I'm grateful to all of you, I think one of the main reasons for not to having our healthcare system overwhelmed is early preparedness. As you know, some of you participated and active in the preparedness and surveillance system, which is very good. If I remember right, the first meeting we held in the Ministry of Health was either 12th or 13th of January, before the WHO announced it is a public health concern. And that preparedness so far, alhamdulillah, uh, made our healthcare system more resilient, even though, and I think all of you know, that the resources available for healthcare system in Oman and in many countries for that matter are not matching the need, and we have shortage in almost everything. But because of hard work, dedication, and commitment of all of you, so far, walillah alhamd, it's holding up. So the main challenges are very obvious. Uh, well, obvious to those who are involved in daily basis. Human resources was one, but initially it was not the main challenge because there were a few cases. I think the struggle we had in the beginning is competing with very rich countries to get the PPE personnel, protective equipment, to get more ventilators, to also buy the medication that they were recommended. You won't believe how difficult it was to compete with countries which were sending people to, mainly China was the main supplier, with suitcases full of cash. I'll give you one example. In one of our purchases for ventilators, we were transferring the money electronically from Oman. It was Friday, I remember, 1 o'clock in the morning, our time here, and I'm grateful to the central bank. And before our money arrived there, somebody handed cash to the company, and we lost that the first I think 60 ventilators. Alhamdulillah, we managed to. So the challenges were huge, but the hard work, the dedication of the team made it easier. Is my voice clear to everybody? Hello?
Yes, clear, Dr. Ahmed. It's very clear.
Okay. So and the challenges, of course, I'm sure there'll be more questions. The challenges will continue, and some of them now actually more of social. The challenges of healthcare. His Majesty Sultan Haytham and his government were very supportive, and I think that's very clear from the decisions taken by the Supreme Committee, which was formed by His Majesty's order to manage the COVID-19 crisis or pandemic. And the healthcare system, of course, is well represented in this committee. And to be fair to the committee, the chairman and the members, the advices and the suggestion of the healthcare system are taken on board, and usually they drive the decision, and we try to make our decision evidence-based. We try to make them also gradual. I'll have to state from the start, there isn't right or wrong in managing this pandemic.
Absolutely. That's absolutely right.
They are countries which took very extreme measures, and unfortunately that didn't yield the result they expected. They are countries which unfortunately were very relaxed, and it was disastrous. They are countries who are in between, and I think in Oman, I think we are in the middle as well. We did not go either way. Unfortunately, the Swedish experience, which most of you know, that they decided to allow the virus to just take its course and protect the most vulnerable. They regretted that. According to the data which came from Sweden, the death rate per million of their population was much higher from their neighboring countries. So in Oman and the region, I think we and our colleagues in the GCC took the sort of middle ground. And I know our brothers in Kuwait, they had curfew for 3 weeks, complete curfew 24/7, and unfortunately the cases dropped only very, very marginally. So in Oman, we are in the middle, and this virus is unfortunately, its behavior is making it very difficult. And I hope it will not sort of follow what Louis Pasteur said in the 19th century. All of you know him, microbiologist. He said, "Gentlemen, it is the microbes that will have the last word." I hope this microbe will not have the last word. So I hope I answered your first question, Dr. Hilal. And as you said, we'll be very informal. And as you could hear, we'll be mixing Arabic and English. Badr told me that there are a few colleagues who don't master the Arabic language. So we'll be in English and a few words in Arabic. Hello? Are you with me?
Yeah, Doctor. Yeah, Doctor, with you.
Shukran.
شكرا. So yeah, Maalik, there is a questions like about how senior leaders could ensure that the hospitals and administrators follow the right guidelines and policies. Always they have like confusion, and you know that, for example, for COVID-19 today and yesterday they announced the dexamethasone. So there is like new updating things. So how would the healthcare could adapt with this rapid change, we could say?
The good thing with the healthcare system, there are levels of command. And for me, the most important part of leadership is the empowerment of the frontline staff. And when it comes to clinical guidelines and treatment, I think my colleagues in the ground, they know much better than I do. I was excited yesterday when I heard that dexamethasone is proven to be beneficial in reducing the death rate in patients. The trial was in the UK. It was a BBC News item. I forwarded that piece of news to some of my colleagues in the hospitals and the ministry, and I had a phone call from one of them, and they were already using one type of steroid called methylprednisolone. I'm sorry, just in case there are no physicians listening, I have to sometimes use simple word, but methylprednisolone was used. Dexamethasone is, of course, maybe more appropriate. So how do they implement what the guideline and the policies? I think the policies are formulated by them, and I believe that they should have the ownership, or feel the ownership. And that's why I think implementation has been very good. We have healthcare system in Oman well integrated during this crisis. I can tell you that the private sector has been on board with us. They are taking lots of the burden. Our colleagues at the university hospital, armed forces, the police hospital, they don't have capacity for admission, but they are also with us in all the policy making. So it's a teamwork, and because the policies are set by the people who are on the ground, the implementation, I would not say perfect, but it is satisfactory, and we learn from each other, we help each other. And I think the channel of communications between the headquarters and the rest of the health facilities is very important. And we have مركز الإدارة الحالات الطارئة, the emergency preparedness center, the ministry. It's open 24 hours, 24/7, and managing that. We have major challenges with ICU beds as yet. The beds are available, but the staffing, and I can assure you that this was discussed yesterday in the higher committee meeting, Supreme Committee meeting, and hopefully the solutions will be implemented very soon, and that's by getting highly specialized ICU staff from countries from outside Oman. So go back to your question, the implementation is not easy, but because of I believe that all the protocols, the guidelines, the policies are shared from the start, prepared by the frontline staff with their colleagues at the ministry. that makes it easier to disseminate and to implement.
Thank you very much, Your Excellency. I'd like to take into another thing. Leadership, particularly at the senior level, is becoming more about influencing across boundaries, taking broader and more multiple perspective about recognizing and integrating complexity. Your Excellency, can you tell the attendees, please, about the importance of transparencies and the high ethical standards in order to gain the public trust? Because this is one of the things that people always look at it. Your Excellency, I can see the numbers now is more than 400 attendees, and we welcome also our people who doesn't speak Arabic here. We really thank them also. They're people from the different sectors in the health system in Oman and outside Oman. So what is the transparency and high ethical standard that make the public trust us here?
I think, let me talk about Oman in general and then healthcare in particular. I think from the era of His late Majesty Sultan Qaboos, Allah yarhamu, and of course it's continuous with His Majesty Sultan Haytham, all policies of Oman are basically very solid, evidence-based, consistent, and transparent. We always have these sort of the transparency in whatever we do. What happened, which is new for us in Oman during this pandemic, some of you probably been watching the weekly press conference. Unfortunately, tomorrow's been canceled for reasons beyond my control. But this weekly press conference and daily announcement of cases, death, number of tests we do, I hope, and the feedback I had, we had the public trust. The followers of the weekly press conference is very high number. The ministry press release, which are daily about the cases, as I said, even we've gone beyond the transparency of many advanced countries. I'll give you an example, death rate. In many countries, if a patient admitted to a hospital, or they are already in the hospital with pre-existing conditions, comorbidities, and the cause of death was not directly related to COVID-19, they don't count that death as part of COVID-19. Up till now, we are actually counting every person who is positive, COVID positive. And we have examples of patients, rahmatullah alayhim, who were bedridden for 10 years. They were at home. They never left the house, but unfortunately the virus was brought to them. And they died, and they were counted as part of our numbers of COVID-19 death. The same with number of cases. Every day, we announce the number of cases, and now we publish in which wilaya as well. So I think the public realized that whatever information coming from the sources, whether the Ministry of Health or other government sectors, they were consistent, they were reliable, and that made the healthcare system actually is basically the talk of every household. I had feedback from so many different sources, and I think that the trust of the public has increased significantly. The appreciation of you who are the frontline in healthcare, we could not wish for any better appreciation. Everybody value what you are doing. Everybody appreciate that you are under tremendous pressure, and yet you are performing very well. I hope this will continue, and we can capitalize on this for increasing the fund for our healthcare system. It's unfortunately in many countries, and I can tell you, even in Oman, many look at expenditure on healthcare as a waste. It is the best investment you could ever think of. If you see what's happening during this pandemic, healthcare systems in many countries which are very advanced, much wealthier than Oman and countries similar to Oman, their healthcare system didn't cope. So I hope with this realization from the public, from the government, that investment in healthcare is truly investment and not waste of money, you will see in the near future projects, and I don't mean by projects buildings. I'm not very keen on buildings. The only thing I'm very keen on building human resources, but also we need, of course, some building. And for example, I'll give you one very obvious example. Our public health lab. I can tell you that that project started in 2009 and it's been delayed for reasons beyond the Ministry of Health control. His Majesty, as you all know, in our last meeting with him, he gave his instruction to start the process, and hopefully before the end of the year, everything will be set and we'll have a state-of-the-art public health lab, which is badly needed. So let's go back to the trust and the transparency. I think we definitely should continue the transparency. I think it's one of our principles in life, and whether you look at it from the religious, from the cultural, it is part of the way we do things, and we will never.
Absolutely. Absolutely. Your Excellency, that's excellent. I will take it from there. And since we're talking about the public, how do you see the public behavior response in Oman? I know that at the beginning of the crisis, we had some hiccups. And then during closer to the Eid time and late Ramadan, also we had a bit. But how do you see it? Is there more awareness now? Is there more behavior response? Especially that we have seen at some stage there is the mortalities had increased, which is anticipated knowing the natural history of the disease in certain other countries.
I think to start with, I am honestly very grateful to everybody in Oman, whether Omanis or non-Omanis. They were very crucial part of the management of this pandemic. And we started the awareness program early in the pandemic, and the response was excellent. And that's why the rise in cases initially was not alarming. And that gave us time actually to prepare our healthcare system, which nobody expected this disease to have the impact it had on our lives. I think you've heard His Excellency Dr. Al-Hosni a couple of days ago. We had 100 patients in our intensive care units in Oman who are COVID positive. That's the first time in history to have 100 patients with one disease in ICU. Of course, with time, the public, and I've been repeating this every week, they've been very good, very patient, but there were challenges. And one of the major challenges we were faced with, unfortunately, some of the expatriate communities in Oman, and we are grateful to the work they are doing, but I don't think they fully understood the dangers or the impact of this disease. I don't think also, even though, to be fair to their country's ambassadors, I've met all of them, and also to be fair to the healthcare professionals or staff, they prepare documents by all the languages. So the outbreaks, like the one in Matrah, which unfortunately spread to many parts of the country, the one in Al-Mawalih, the fruit and vegetables market, if you look at it, most of the cases or the source were people who were not adhering to the healthcare advices, whether their personal hygiene, whether the social distancing, and the public who were following all these, they were asking me questions. Doctor, you told us to stay at home, we stayed at home. You told us to do this, but the cases are increasing. Of course, part of this is natural of the disease, but the main thing, unfortunately, during the month of Ramadan, and I know it was not easy, asking people to keep away from their beloved ones, asking them to stay away from the mosques, asking them to change completely the way we all used to live, and especially in Ramadan. Ramadan is more about socializing, and of course I know it's a religious event, but all of us know that in Ramadan we make points of gathering, sitting together. So if you look, when our cases started to increase significantly, it's from the second half of Ramadan onward. And of course, I cannot blame Ramadan for this. There were other factors, as I said, the expatriates, but the public were great. They were very supportive, and they are still. And now we have to live with this virus for we don't know how long. The vaccines, there are many promises, but the track history of successful vaccines for coronaviruses are not that great. I'm very optimistic usually, but if you look at SARS, if you look at MERS, if you look at other coronaviruses in the past, there's still no vaccine. Of course, the difference with this one, there's lots of international collaboration. So the public, yes, they were partners, they were key for our success, and I continue to urge everybody, all of them, to follow the instructions, to keep their social distance, and the mask proved to be one of the crucial part of prevention, with, of course, hand hygiene. This, we need to repeat this message everywhere. And with everything else, you can have so many regulations, you can have so many laws, you can have so many circulars. I think we need some time, unfortunately, the presence of deterrent. And here I have to mention Oman Royal Police and Oman Army. They've been very good in helping to keep people aware, basically, and reminding them in public places with masks. Are we doing enough? I think we can still do more. Are the public cooperative? Yes, but they can still, we expect more. I have to say here also something else about this pandemic, the media in Oman, and I'm sure elsewhere, they've been excellent. They give us more than enough space, and they are with us all the time, and they are counteracting rumors. This is very important in crisis to have the information from the right source and to disseminate it to the as widely public as possible. And we are using all sorts of medias, as you know. So yes, go back to the public. I'm grateful to them, but I urge them to do more. I urge them to be patient with us. This virus has changed the world completely. The world pre-corona is definitely not as, it's not going to be the same after corona in all aspects of our life. How long are we going to put up with this? Only God knows. If you listen to the epidemiologist, and if Sa'adat al-Husni with us, is one of those who are always talking about the second wave and the third wave. I am optimistic and I'm hoping that we will not have them, but also I'm realistic and we are preparing for the worst.
Thank you, Your Excellency. In one of the WHO COVID-19 briefing, WHO Director General, who's a close friend to you as well, and we've been strongly collaborating with them, said that strong and resilient health system are the best defense, not only against outbreaks and pandemics, but also against multiple health threats that people face. How would you evaluate the following health system in terms of infrastructure and preparedness for crisis, human resources that we are having in Oman, preparedness, performance, and the stress, and the society? The fear of health professionals, you know, at the beginning of the pandemics, there were a lot of health professionals who were very skeptical and they were keeping themselves away. And over the time, we saw them merging themselves into the system. So how do you evaluate those, Your Excellency?
I will start with the healthcare professionals. I think it's natural to have a fear of unknown, and this virus, it was, and still unfortunately we don't know much about it. But I am extremely impressed with the commitment, dedication, motivation of our healthcare staff, and of course their colleagues who are the supportive staff. And they prove to be angels of soldiers and angels as well of this time. If we come back to healthcare in Oman, let me start with healthcare financing. In Oman, we spend as a government about $1,500 per person per year. The share of the Ministry of Health of that amount of money is about $750 per person per year. Even though the Ministry of Health provides about 80% of the care. Of course, our colleagues in the government sector, whether the Sultan Qaboos University Hospital or the armed forces or other They are doing a great job. But if you look at the healthcare expenditure in Oman, if you compare it to countries with similar income, it is very, very low. From government expenditure, and I'm sorry I have to throw terms here and I'll explain them. We spend less than 6.5% on healthcare. The average in many countries about 12%. From GDP, we in Oman spend less than 3.2%. The average in Europe is about 9, well, 10, it used to be 9, now probably 10%. If you want, I'd like to say, to use absolute numbers. I said in Oman, we spend, as Minister of Health, $750 per person per year. In many European countries, OECD countries, the expenditure is between $3.5 and $4,000 per year. So if you start from that number, that will reflect on the infrastructure Dr. Hilal you've asked about. We prepared a plan in 2012, the new team at the Ministry of Health, which was submitted to the government in 2012, of the need of the healthcare facilities in Oman, facilities, equipment, human resources. And we estimated at that time that the cost about 1 billion Omani Riyal, and that would have been spread over 7 years. I can tell you, and we spoke about transparency just in the question, I think last question or the one before. I can tell you from that amount, we received very, very, very little. I'm not going to tell you how much, but I can tell you it's not even one third of what we requested. So the infrastructure, we have hospitals which were designed in the late 80s, built in the 90s, and many of you have been to them. I mean, if you look at the ICUs in our hospitals outside the capital city, unfortunately, they are not up to the standard of any level that you and I would love to see them in. If you look at when we had H1N1, I was appointed as an undersecretary, and unfortunately the first challenge was H1N1. And I remember I sent one of my colleagues, who is the head still of ICU and anesthesia at the Royal Hospital. I sent him to different hospitals to look at our equipments and mainly ventilators. And one of the feedback I had from him, he said, Flan, Doctor, the ventilators in some of your hospitals should be actually in a museum. He said they are not suitable for. So that's the case. I can tell you that many of the equipment that we use in our hospitals and our clinics, unfortunately, some of them exceeded their use by date by 7-10 years. If you go to the facilities themselves, the kitchens, the buildings are obsolete. We are very lucky. We don't have many infection outbreaks. Let's go to the human resources. Human resources also. I think since, and this is not my own only sort of mission. It's all our mission to build up human resources. And I think it's very obvious between 2010 and now, we managed luckily to increase, and Dr. Hilal and the OMSP, they have major role in this, increase the number of scholarships. We managed to increase, even we started undergraduate scholarship for medical students. So we are building human resources, but all of you know, preparing doctors is very lengthy process, very expensive process. So when it comes to human resources, also, unfortunately, we are hit badly in 2017 or before, when the economic crisis started. For those of you who like numbers, the Ministry of Finance basically decided to remove 2,440, I think, grades from the Ministry of Health. So can you imagine, you are already low in staff and you lose 2,400 sort of your grades. You could have got 2,400 between doctors and nurses, physiotherapists, all allied healthcare professionals. So human resources, yes, we are short of that, but that shortage covered by the hard work all of you doing, the dedication. And I think we are lucky also, and part of it is not luck, it's demography. Our population is still young. But unfortunately, we are aging. Some of you are still very young, but some of us are aging. And the other thing, you know about NCD, non-communicable diseases, are on the rise, and I can assure you they are not forgotten during this crisis. So the human resources, wherever you go, we do have shortage. Wherever you go, we have need. But let me say, this is across the board worldwide, actually. I remember a few years ago, I was in a panel discussion in the UK, and they were ministers of health from different countries. And the last question was, what is the relationship between the ministers of health and ministers of finance? I was the last in the panel discussion, sitting at the last seat, and also the last to answer. So all of them were, oh, great, good. And this was broadcast in the BBC. And I said, do you want me to lie like my colleagues, or you want the truth? I said, there isn't a minister of health who like the minister of finance, and vice versa. This is not personal. But whatever we ask for, there's no way we can get it. But there is a happy medium. What I'm hoping that the future should be bright for the healthcare system. This pandemic, this pandemic, I think, opened the eyes of everybody that healthcare system need to be truly the priority, not just in the media, but truly health and education are the cornerstone for building any nation. And I'm optimistic that this will happen. And I know the sad thing that over the last 2 years, the acceptance or actually the application for medicine at Sultan Qaboos University was less than the number which the seats available. This is very alarming. People looking at healthcare now, why should I go and spend my life doing medicine while I could go and be an IT or an engineer? But I think there's more to medicine than money. There's more to medicine than fame. I think it is a passion, and I count on that in all of you, your passion, your love to help and serve your community. And that's why healthcare professionals, yes, we are short in number, but I can tell you that deficit in number is compensated for by the hard work, by the dedication. I can tell you that your colleagues, when we started bringing Omanis from abroad, students and the public who were stuck abroad, some of your colleagues from health, from the Ministry of Health, they spent 30 hours at Muscat Airport sorting out quarantine, the staff, people into quarantine, 30 hours non-stop. I challenge any other sector can say about their staff working 30 hours, no grumbling, no asking for extras. It is just doing what they think is their duty, and I'm grateful to all of them and all of you. And I think saying I'm proud of all of you is not enough, but I can also convey to you that in every meeting with His Majesty Sultan Haytham, he always had praises for healthcare professionals. That makes me very happy. He appreciates what you are doing, and I can assure you that he will be like Allah Yarhamu Sultan Qaboos, very supportive of healthcare system.
Thank you. I'll move to the last question, Your Excellency, from my side, and then we'll see some of the questions from the others. But every doctor and healthcare professional is a leader in his or her environment. And I remember your quote when you said, health system pre-COVID is definitely not going to be health system after COVID. What is your advice for them to make Omani health system stronger, more resilient? Do we take the opportunities also to think outside the box, like the virtual consults that have been started in some hospitals, like improving, getting the e-health more stronger, and changing the way we are practicing medicine ultimately. I have to thank all the participants also that are going on with us, which we reached close to 500 at some stage. So would like to have a feeling, what do you think? What's your advice for them to become more stronger and resilient?
Sometimes I envy you guys. You are very young and dynamic, firstly. Secondly, the opportunities you have in your training. is much better than what some of us had when we were medical students or postgraduate trainee. Leadership and administration were not part of any curriculum that I've been through. Leadership was basically you learn it as you go. You either have it or you don't. And I'm glad to say that now at both undergraduate and postgraduate level in medicine, leadership and administration are part of the teaching firstly, and I think everybody realizes whatever level you are in as a doctor, you are a leader, and you have a team that you have to be leading. This crisis or this pandemic taught us a lot of things that the potential is huge for the younger generation, for the future healthcare leaders, as you said, to think outside the box. I never thought that in Oman, in my at least career life, which I would see Omanis, young Omanis, actually having the talent. I know you are very talented, but having to think, yes, there's shortage of ventilators. Let us make ventilators in Oman. I've never thought that there'll come a time when the need actually made people think beyond what they used to. And I can tell you, lots of personal protective equipment will be made now locally. So this is related to health leadership, but in leadership in healthcare, every doctor, every nurse, every physiotherapist, everybody in the healthcare is a leader. And in the future, it's not only leadership, it is we need to basically come up with initiatives to, I can tell you this remote clinics in Oman, not remote, but I mean by remote virtual clinics, we never thought that we will need it in the at least now or near future. Your colleagues thought about virtual clinic and it started actually, and a lot of things will be learned from this crisis. And I'm counting on you to come up with suggestions, initiatives, ideas to make our healthcare system more sort of efficient, which I can tell you, the efficiency of healthcare system in Oman, it's not me saying it. It's been published by WHO on several occasions. It's one of the most efficient healthcare systems. And please, for those who, I know all of you are professionals. If I say this in the public, they say, oh yes, listen to what he's saying and there's a waiting list. Listen to what he's saying and there are medical errors. What is meant by that? The return we get in Oman for the amount of money we spend is excellent. It is the best return compared to many other countries. I told you how much we spend, and yet look at our healthcare program. Our vaccination rate is one of the best worldwide. Our primary healthcare is excellent. I don't see the waiting list. I don't like to have a waiting list for a day for patients. But if you compare it to countries like the only country I could think of because I was there, it's UK. Our waiting list is much better. The access of the patient access to doctors is much easier. Our primary health care is open round the clock in many areas. So you made the leadership is not a book you read. It is what you practice. And I think most of you are doing an excellent job. And I hope also that whoever had any ideas how to make things better, I'll be more than happy. Any feedback, any constructive feedback, I'll be more than happy to look at it. I get every day hundreds of messages from the public suggesting how to manage this pandemic. And I can tell you some of them actually, but some of them, unfortunately, they want to use the methods of treatment that I think none of you will accept. And I'm not going to mention them because I'm sure you read the social media as much as I do.
Thank you very much, Your Excellency. I think we will have 3 short questions from Badr, where most of the questions that was asked from the public, from the panel, have been included, but 3 short questions with 3 short answers before we conclude. Badr,
yes,
the floor is yours.
Yeah, thank you so much, Dr. Hilal and Dr. Ahmed. So we have so many questions actually. So what we did is that we sorted out and we picked the most relevant topic. So maybe Maalik, if you could like give us like a short answers before we
Sure.
close. So the questions, we have so many questions regarding the role of private sector in this pandemic, as they are like a key pillar in this health system. So what do you think, Maalik, how was the preparedness of private and their...
I've mentioned this already, and I think they've been very helpful, and we are working together. We work side by side in the private sector and the government sector. And I can tell you an example. Some of the private sector hospitals are short of ventilators, and they were provided with ventilators from the Ministry of Health. So that's just one example. And I wish the private sector in Oman will grow and be competitive with the government. We need that for two reasons. One, to give the public the choice of access firstly. Secondly, if you have somebody competing with you, I think you'll always strive to do better. So that's in summary, they are partners and I'm grateful to their help, but it's mutual. They help us, we help them as well.
Yeah, great. So Maalik, you mentioned regarding the ventilator. So there's another questions regarding this issue. So as a lessons learned for the future preparedness, just in case for لا قدر الله any second wave or any other pandemic لا سمح الله. So what is the plan of health system in Oman for this issue?
I think preparedness, as I said, is a key for any success. Preparedness and leadership also taking decisive decisions. One of the things I was asked in one of the press conferences, oh no, it was not actually a direct question, but it was sent to me from so many public, whether they are supportive or some of them not, buying like hydroxychloroquine. What are you going to do with this? If we didn't buy it at the time when it was published and that it's effective and it helps, of course they'll blame us. So I think when you prepare for a crisis like this, you need to take decision on the information, that the data available for you at that time. And preparedness, yeah, it was a challenge initially. And I'll tell you, we sent 18, between 18 to 20, I think it's 20, but to be on the safe side, 18 planes to China to bring the medical equipments, PPE. And I can tell you also, one of your colleagues, and few with him as well, but one of your colleagues was going back and forth to China in every flight to open the boxes there, check the ventilators are there, check this monitor is there. And that, I don't think any country did that, sending doctors within the plane. And this is actually, he volunteered himself. And I'm not going to mention name because all of you are very dear to my heart. And if I mention one name, I'll have to mention the 500 at least who are here now, and I don't remember all your names. So yeah, early preparedness, that we learned a lesson that we have to have enough stock of everything we need. And I can assure you, we do have enough ventilators. We do have enough beds. What we are short of, the human resources for intensive care. And my team and I have been working very hard on that. And there is a light at the end of the tunnel. And I'm hoping soon we'll get more staff for intensive care units.
Well, I think we will conclude this. Your Excellency, I'd like to express my sincere thanks and appreciation for sparing the time with us despite your busy schedules. Definitely the 500 physicians from around the world, the Omanis and the non-Omanis who are serving also here in Oman, have been very grateful for the time you had spared with us. We really value and appreciate this. And thank you very much. Thanks for the panelists as well who have been joining us, and thanks for the team who had joined us from all over the world. Thank you and have a very good evening.
Thank you very much. Just to mention one thing, Oman's been selected also to be, we are launching next week something called the Coalition for a Universal Health Protection Architecture. Oman was chosen as one out of 6 countries in the world to lead this initiative. It was started by the Swiss government, and I think all of us in Oman should be very proud to be partners in this very, very important initiative, which is to protect the healthcare order in the world. And we'll need all your help also to make this to put Oman on the map as it is worldwide. So thank you very much to all of you. Please look after yourself. Your safety should be the priority, because if you are not well, if you are not safe, you will not be able to help the others. And don't forget that you first, your family second, and then us, the public and work. So thank you very much again, and hopefully we'll have more encounters and meetings, and I'll be more than happy to answer any questions that I couldn't answer tonight. Thank you.
Thank you. Thank you very much, Your Excellency. We will definitely excel and rise under your leadership, and we look forward for all these initiatives that had placed Oman and the health sectors in Oman in the map worldwide. So we really appreciate it. Thank you very much for all the panels and the team who have joined. And we wish you a lovely evening, everybody. We shall meet again next week, inshallah, or the week after, with a new guest, where we have new ideas and new innovation. This excellence in health care series that is going to be continued from Oman Medical Specialty Board as a public awareness for the physicians. Thank you, and thanks everybody.